Welcome to the video on compendial method verification versus analytical method validation. You might be knowing the terms like verification and validation. In the analytical development, these two terminologies are very important and are very required to know. We know that the analytical methods are required to be precise, accurate, and reliable, easily transferable from R&D to QC. Some methods are developed in-house and some methods are already available in the pharmacopoeias. If the method is available, then it is called as compendial method, monograph method, or pharmacopoeial method. If the methods are not available, then these methods are required to be developed. If the new method is developed, that time full analytical method validation is required, and if the method is available in the monograph, that time the method verification is required. Now let's start with the video to understand these two terminologies in more detail. Compendial method verification versus analytical method validation. So knowing when to validate and when to verify is very important. If you perform validation instead of verification, you will lose more time, more resources. And if you verify instead of validation, then it will lead to the situations like you will get the audit points. Once again, the regulatory requirement will be there for the validation, so it will delay your work. So why this matters? Whether you are going for verification, whether you are going for validation, why these things matters? So as we know that the reliable analytical results are critical in the pharmaceuticals. Regulatory agencies expect clear justification, and misunderstanding between these two can lead to differences in the validation and verification and their requirements. It will lead to audit findings, then delays in the product release, wasted resources. Because if you perform a wrong thing, that is validation instead of verification or verification instead of validation, it will delay your work. Now what is method validation? So new methods are developed are required to undergo validation. If significant modifications are done to the existing methods, that time also validation is required. Full validation is to be done as per the ICH guideline Q2, and validation is done to demonstrate the method's suitability for the intended purpose. This is regarding the validation. Validation parameters are there for the analytical method, like analytical solution stability, accuracy, precision, specificity, LOD, LOQ, linearity and range, robustness and ruggedness. Precision involves repeatability and the intermediate precision. LOD is lowest limit of detection. LOQ is lowest limit of quantitation. So these all parameters are required to be performed in the method validation. Or in other words, you can say all these parameters are there in the method validation. Now coming to the verification. So what is verification, or what is the method verification? If compendial method is available, then you can go for the verification. For existing compendial methods, There is no full validation requirement, but the method should undergo the verification. Methods may be coming from the USP, PHUR, IP, VP, and JP. That time you need to perform the verification, not the validation. The verification confirms method works in your lab environment and with the analyst instruments, sample matrix available, and you are going to verify that method suitability, that is method verification. Method verification focus areas or parameters you can say are the system suitability, specificity, analytical solution stability, precision and accuracy. Then example for method verification is using a USP assay for tablet product. Still you need to verify the method in your lab before the routine use. It ensures accuracy under your conditions. So validation means is the method suitable for its intended purpose, and verification means can the method work reliably in my lab. So we need to choose the right approach as per the requirements. For new methods, validation is required, and for the existing and compendial methods, you need to do the verification. This is the information and understanding about the method validation and verification, when it is done, and what are the parameters. I will be making many more videos in upcoming time for the analysis of the pharmaceuticals and validation and verifications. Thank you for watching the video.